at the Mackinac Policy Conference on behalf of the Michigan Health and Hospital Association and the Common Bridge Substack and podcast. I'm your host, Rich Helppie, and we have with us today the Executive Vice President and Chief Operating Officer of the Henry Ford Health System, the illustrious Denise Brooks-Williams. Good to see you.
Good to see
How have you been?
I've been well.
And I hope it was okay to introduce you as illustrious. I could redo the intro.
That was incredibly kind.
I know you, so I know that anybody look her up, and you will find out that that's very true. All right. But let's talk a little bit about Henry Ford. Is a leader, has been a leader, has been there for over 100 years, and now it looks like you are ready to launch further. It's so exciting. Tell us about what's going on.
It's incredibly exciting. So as you said, Henry Ford Hospital, specifically 111 years in the city of Detroit on West Grand Boulevard. And so honestly, probably 20 years in the making has been an idea around how can you advance that campus and do it in a way that's going to reform care in terms of how it's delivered and the setting it's delivered in. So fortunately, over the last probably 3 years, we've been able to move the project forward. We called it the Future of Health. And the Future of Health is really our opportunity to partner very broadly with the Detroit Pistons, Michigan State University, and the Gilbert Family Foundation. And so there are several projects within there. One of them we call Destination Grand, which is a new hospital that's being built, a little over 1 million, like 1.2 million square feet, $2.2 billion investment. It will allow us to have all private rooms for the campus, new emergency department with a particular focus around behavioral health, also state-of-the-art in terms of technology and infrastructure, all new operating rooms. But I think the most important part, not just the physical structure, but what it's going to do to transform care in the community. Worked really closely with the community to actually conceive what needed to be there and how we needed to have the campus really be evolved over time. And then the partnering piece of it is really housing. So the Pistons are coming in as a housing partner. A new rehabilitative hospital, Shirley Ryan Ability Lab, will be there. That's what the Gilbert Family Foundation is funding. And a new research building, which is the Michigan State Partnership.
It sounds like a lot of joint ventures going on.
A lot of joint ventures, yes.
So lots of negotiation and...
Lots of negotiation and partnering.
Has there been an announcement that if there has, I'm not aware of it, what will happen to the old property?
So the old property will stay there. Well, we've kind of softly announced it as a part of the project, but it will stay in place. We have a lot of ambulatory activity that happens in the campus today, and that will, conceivably stay. We also will look to figure out how we might utilize the space from an inpatient perspective, because we do have some capacity to actually have some private rooms there and have some services on that side. So at this point, it will remain a part of the overall footprint of the campus.
So if I was a resident of the city of Detroit and I said, how does this impact and benefit me, what would you tell me?
The first thing I would say is that if you're a resident of Detroit, you're lucky, because we have a process called Community Benefit Ordinance. So we spent 9 weeks with community members who were elected based on the impact census of the project. And what they told us they wanted to make sure is that healthcare was going to be affordable, accessible, and that they would be able to see health status actually improve in the community. They also wanted to make sure we had transportation. We thought about retail and what might be other services that would come in. And the beautiful thing with this project is listening to that community voice. They're going to get all of that and more.
Wonderful. I know Mayor Duggan, when there were tax incentives for employers, said, but I'm only going to offer those if you employ citizens of Detroit, residents of Detroit. Was any of that baked into this development?
It was definitely discussed, absolutely, and a part of that city ordinance certainly suggests that there is attention paid to who's a part of the project. And as we know, our laws have evolved federally, so we're utilizing the federal law as it relates to who participates. But there are a lot of Detroiters that are able to be engaged in that work. And so we have our construction company probably doing the majority of that in terms of the trades, that are a part of it. But there is intentionality around trying to ensure that the city of Detroit benefits as it would be from the project. So we know permanent jobs, obviously, because they're going to be located in Detroit, have the ability to really impact the economy in a positive way. So if you come in to work with us, you're going to contribute to the city of Detroit tax base.
I asked that question because often on my podcast, I find myself being the homer for Detroit because there's so much positive going on and the energy, and this is going to be a real big catalyst here.
Absolutely. As you said, Mayor Duggan, a huge proponent and supporter of the project. We also had the benefit of working with our now new mayor, Mary Sheffield, who at the time was the city council president. And I think to your point, she sees it as a huge catalyst around, we have seen other developments already start in that community. You have the Motown Museum, and I know Robin Terry is here at the conference, but you have the Motown Museum that is in their whole rebirth and renovation. We're able to partner really closely with the Detroit Public Community School District because we have schools that are in the footprint. You have other businesses that will benefit. So it truly is showing it as a catalyst for the whole community.
Well, I'm glad you mentioned the Motown Museum. Everybody that's listening or viewing this show should go there, and you get to sing at the end of it in the studio that the Temptations recorded in. Don't miss it.
Absolutely.
All right, especially if you can hit the high notes. Go there like that. The Henry Ford Health System, which of course has been an icon in Detroit for a long time, 111 years.
Yes.
Now you're expanding the footprint across the state. What's that journey been like?
It's been an amazing journey to really be able to look at. So if you look at our name, Destination Grand, the destination part is having destination care, which for us is in Detroit. But the beautiful thing is that now that we have our joint venture with Ascension Health, so we've brought in new access points, which, as you said, really do span across the state at this point. So what I believe it means is our ability to partner in communities, because care is still local for us, but have all the expertise of the Henry Ford Health System be available in those communities.
And how far out state does that go? I know you're in Jackson.
So we're in Jackson, we're in Genesee County because we have the Genesis Health System that's a part of it. We actually, through collaboration, not related to the Ascension joint venture, but other partnering, have Covenant Health in Saginaw. We have, of course, always had care come to us from the UP and other areas in terms of coming to Henry Ford Hospital. So we would say we cover the entire state.
Indeed. So somebody in Saginaw would have access to the deep specialists that Henry Ford is known for.
Absolutely, because we have specialty clinics actually that are being placed in that community. So it allows them to get the primary specialty care local and close to home. And if for whatever reason they needed more advanced care, we would try to do it there. If we couldn't, then absolutely they would be able to come to another Henry Ford site.
What are some of the headwinds, and particularly since we're at this conference, anything that might be addressed at a public policy level?
Definitely, there is a lot of public policy being discussed. We know that one of those is 340B. And how do we ensure and make sure that we have access for pharmaceuticals for our communities that are vulnerable? So a lot of discussion, at the state level about maintenance and retaining a form of 340B. We don't believe there's a lot that needs to be, modified with it currently, but understand that if it is modified, it's still very necessary to have pharmaceuticals at an affordable rate for the community. There's obviously also a lot of discussion around Medicaid and what it may look like. We are one of the lowest reimbursed states, as we know, so very little room for there to be any further reduction. So a lot of discussion about how do we at a minimum maintain, and again, if we need to reform in such a way that we don't have anyone, left out and vulnerable that really is sitting from an economic perspective vulnerable today.
I'm really encouraged to hear that because the pharmaceutical, the inpatient care, the two pillars driving cost. We've had more time to talk about denials and things like that. Are there any final thoughts you'd like to leave with these two audiences that are beating in?
I definitely would say this conference, as you know, is themed Common Ground. And so I think as we think about healthcare affordability and access and ensuring that we have rich resources in the state of Michigan, we have to find that common ground from a public policy perspective.
Indeed. Much to be gained by working together and much to be lost by not doing that. We've been talking with Denise Brooks-Williams, the Executive Vice President and Chief Operating Officer of the Henry Ford Health System. Very exciting things happening with Henry Ford in the city of Detroit, across the state. On behalf of the Michigan Health and Hospital Association and the Common Bridge Substack, and podcast. This is your host, Rich Helppie, signing off.